we're here interviewing Matt Reddy, and I really appreciate all the great things you've done to give a voice to the public. You've been an advocate for the public for years and years and years, and I wanted to come over here and interview you about being a hospital commissioner and the job you used to have, and just to get a little feel about you. So tell me about the foundation of your work with Jefferson Healthcare.
Sure. Well, I've been associated with Jefferson Healthcare for, I guess, 25 years now. 15 years as an employee, and now 11 years as a commissioner. And I was in the IT department for years, and then I was in the performance improvement department for another 8 years. And I ran for hospital commissioner because basically as a part of my activism, I consider myself an artist, philosopher, activist, and politics is just another form of activism. You run for office to try to hopefully change things, make things better. And so that's basically how it got started. And my journey as a commissioner has been quite an adventure.
And I remember 15 years ago, 10 years ago, when you were talking about the fact that there's no cameras in the commissioners' meetings.
Yeah.
And I remember when I used to be a producer at PTTV, we filmed those meetings. You want to give me a little bit about that circumstance?
Well, when I first got on the commission, they were not recording meetings. They weren't audio or video recording the meetings. And I immediately noticed that I was not impressed with their consistency from meeting to meeting. So it seemed like a healthy thing to do would be to audio record the meetings so that we had a perfect record of what was said, and then we wouldn't have to rehash things that we'd already decided. So I told the commission I was going to start audio recording the meetings, and this turned into a massive conflict that lasted over 8 years. Because when I first recorded the meetings, they tried to stop me. They claimed a lawyer for the hospital said I couldn't do it unless the commission voted to give me permission to do it, or the commission voted to do it.
But I think it's a really nice thing for the public, because people can't attend the meetings, and when they're not around to do that, it gives us the view of what's going on. We're participating in the public events.
Yeah. Oh yeah, it's essential. I think every governing body, every elected body should have their meetings audio recorded at a minimum and transcribed so that we can see what is actually, so that we can hear what's actually being said. And I've had to turn tons of meeting recordings into transcripts over the years. I've actually self-published 3 or 4 books that are filled with transcripts and emails covering the 2 major scandals that I've been involved with the hospital. The first one being this fight over the right to record a meeting, and this latest one over the Peninsula Health Alliance saga, where the CEO submitted a proposal to Olympic Medical Center without legal board permission to do so, and I had to report this both to the regulatory authorities and to the county sheriff to be investigated, because it was possible this was actually so egregious that it was criminal, possibly official misconduct, possibly conspiracy to commit fraud. And the sheriff did an investigation of that and found there was certainly wrongdoing. And the sheriff, said it wasn't sure if it was possible, went over to criminal wrongdoing, but he definitely recognized the civil wrongdoing. And so that's been a whole new thing.
So give me an explanation of what you did when you filed the grievance with the sheriff.
Okay. Well, it was literally in the middle of a board meeting. I was prepared with a draft of the criminal complaint. And it was during the board meeting that I decided I was going to verbally reveal that this secret negotiation was going on between Jefferson and Olympic Medical Center. And when I first tried to say this during the meeting, they cut me off and they wouldn't allow me to finish speaking, which is
And you tried twice.
I tried three
during
times.
the meeting.
3 times.
And they cut you off every time you tried.
Yep, they muted me twice.
Yeah.
And so once I saw they were going to do that, I finished the complaint and submitted it to the sheriff right there during the meeting. And then then the meeting concluded, and then I was waiting, about 2 weeks before I even heard anything back from the sheriff to say whether he would investigate it at all. And he did. He assigned it to a detective. He apparently had looked at it enough to see that there was definitely something that needed to be looked at. And then it was another several weeks until we got a report. This entire time was very awkward because I didn't know, it's a very awkward thing to report a criminal complaint and have it sort of floating out there and not know if it's really going to turn into something. But the sheriff did an amazing investigation. The detective did. It was great work, really thorough. And I provided, then when I got the report back showing clear evidence of, or clear conclusions that there were violations that were concerning, I forwarded that on to the Washington State Auditor, to the Attorney General.
And as an example of that meeting, there were a lot of Jefferson Healthcare employees attending. It was a very widely attended meeting, and it was very obvious when they stopped you. You got up to say your points, and they said, "Oh, you're out of line," or they said different things. And they specifically stopped you at that meeting.
Yeah.
And I think it's interesting to show that those are public meetings, they're not held in secrecy, and that the state requires those meetings to be public meetings.
Yeah. Yeah, these are public meetings, and one of the times they muted me and cut me off, I was speaking during public comment as a public citizen. So,
and you were sitting out there as a public citizen,
yeah,
making a comment, and they stopped you.
Yeah. Very. That's a free speech, First Amendment, issue. What they did there. So just piling on bad behavior with bad behavior.
And that's why I want to thank you.
Oh.
Nobody helps you with this kind of thing. You see something, and then you let the public know. You take your job as a hospital commissioner seriously, and you are there to help the public. And that's just a remarkable thing because you care. You care about Jefferson Healthcare, you care about the hospital, and you care about the public and the patients. And that's just really nice. As a TV show host, I wanted to thank you for that because it hasn't gone unrecognized. I'm very sorry that I haven't interviewed you before, but I have watched your history for the last 10 years. And every time I think, oh my God, I'm so glad that he is saying something. I didn't do anything to document my opinion, but I am really appreciative of you.
Well, thank you so much.
Yeah.
Yeah. Everyone just needs to do their job when they have a position. Just like I'm so grateful that the sheriff and the detective and even the deputy county prosecutor, they did their jobs, just into doing the investigation. And as a hospital commissioner, you have a job to do. Healthcare is a beautiful thing. You just want to make people healthy. So you just need to lead with integrity and honesty. And so, when I'm put in a position where I'm like, something dishonest is going on, something really wrong is happening, what are you going to do? You either go along with it or you expose it. And you want to be comfortable with yourself and with what you're doing. So you just try to do the right thing, try to not act out of emotion or anger, and just what is the correct thing to do in this role.
And you have done that throughout your history as a hospital commissioner.
Oh, thank you.
And I think a lot of people admire that. They may not say anything, but they quietly admire it.
Yeah.
Now I want to get into the issues of when you ran for port commissioner,
Hospital commissioner.
hospital commissioner. I'm sorry,
Uh-huh.
hospital commissioner. When you ran for hospital commissioner, what were the kind of things that you had to think about when you did that? You know, you were coming from County hospital employee,
Yeah.
and then as another option of it, being a hospital commissioner, what kind of difference did that make?
Well, I mean, one, if I won the election, I knew I'd have to resign my position at Jefferson Healthcare, so I would lose my job and my main source of income, and also just trying to learn exactly what you could do as a hospital commissioner, what powers you had, how you could influence things, what exactly what the role entailed. But I attended the meetings for about a year before I ran for commissioner to really get a feel for what the commission did. And like I said, I was doing it to try to push for universal health care because I just thought there was a way that elected hospital commissioners could really play a role in advocating for that. So I was focused a lot on thinking about how to do that. Could I organize commissioners? What kind of access would we have to elected legislators?
Hi. Now, I was wondering about the benefit and what you have accomplished as a hospital commissioner.
Yeah. Well, I mean, one, more accountability and transparency. I mean, since I pushed for recording the meetings, we now have the archive of the last 11 years of what the commission's been talking about. So there's been more integrity in that realm. And that's like one of my main goals. I want to keep the institution strong. It's one of the most important institutions in our community, not just for healthcare, but for the jobs and the amazing people that work there. So I want to keep the institution strong, and I want to sort of reestablish the honesty and integrity at the governance level, which is a little bit of an issue. And then, my overall goal is I want everyone to have access to healthcare. I want everyone to be able to get the healthcare they need. And there's things we can do at the hospital level to keep our services as accessible and as affordable as possible and have a great charity care policy. And then there's things we can do as commissioners to keep advocating for better healthcare reform. I mean, our healthcare system is a mess, and it needs more integrity, and it needs some more elegant legislation to make it work.
And are you looking forward to September when the new facilities come in and the hospital expands?
It is very exciting, the new expansion. It's going to, have more specialty services available for people locally. And it's a big step. We went into a lot of debt in order to build it. But yeah, it's very exciting. And hopefully I think it'll be a really positive thing for the community. It's just important that the hospital has good leadership and good governance at the top to keep it strong for years to come.
And I look forward to interviewing you again in September.
Yeah.
If that's okay.
That would be wonderful.
Thank you very much.
Yeah, thank you.
Thanks for being on my show.
Thank you so much.
And my show is Public Interest Issues Show.
Great.
Thank you.
Great. Thank you.